Christmas Eve, and joining us now, independent senator from Vermont, Senator Bernie Sanders, joining us from Capitol Hill. Thank you very much, Senator, for being on the show this morning.
Good to be with you.
Okay, Vermont got more community health care centers, additional Medicaid funding for 6 years. Did Vermont get a sweetheart deal and some of the backroom deal-making here?
I have to tell you something. Vermont has led the country in terms of community health centers. This is for 50 states in America. It's going to provide primary health care and low-cost prescription drugs and dental care for 25 million people in 50 states, and it's going to save money for people in 50 states because it keeps folks out of the emergency room, which is the most expensive cost care, primary health care. It keeps them out of the hospital. It keeps them well. And what studies show is that we save money for Medicaid by providing primary health care to people around this country. We're going to go from 20 to 45 million people having access to quality primary health care. Do we have a problem with that?
Probably not, especially not in Vermont.
But it's not just Vermont. This is 50 states in America. This is not a Vermont program.
Let me ask you this. You were apparently, and if I'm correct, on the fence about this. What did it take to put you over the edge?
This was one of the factors. I believe very strongly that the federally qualified community health program is one of the most important public health programs that we have in this country. Our primary health care system is collapsing in America. This amendment is going to create 20,000 new primary health care doctors and dentists and nurses at a time when we desperately need them. Okay. That was an important factor in helping me to vote for this bill. But this is not a Vermont bill. Please, let me be sure. People say $10 billion for Vermont. You could buy the state of Vermont for $10 billion. This is for 50 states in this country. 25 million Americans are now going to have access to health care who previously did not have that.
Lawrence O'Donnell is here. He has a question for you, Senator.
Senator Sanders, obviously there is no public option, but liberals in the House and the Senate, including Nancy Pelosi and others, all year have been claiming there would be a public option. I said in early August there wouldn't be. It was very obvious where the political momentum was going. Were the liberals just stunting on this all year? Did you guys always know that the public option was absolutely hopeless and this was just a way of trying to keep liberals out there in the blogosphere and other supporters on your side as you went forward?
Look, let me be very clear. I happen to believe in a Medicare for all care program, and I try to get at least a debate on that on the floor, which was filibustered. This is not anywhere near as strong a bill as I would like. Of course there should be a public option to provide competition to the private health insurance companies so that we can control skyrocketing costs. In my view, there should not be, as the Senate bill does, a tax on health care benefits. There should be a reimportation prescription drug bill which lowers the outrageously high costs of prescription drugs all over this country. We should have all of those things. The reality is, after all is said and done, there are no Republicans who are supporting this. There are 60 people in the Democratic caucus, and you have some conservatives who are saying, no, I won't do it, I won't do it. So the choice that we're left with is kill the bill now, continue the process by which 45,000 Americans die every year because they don't get access, or pass something and try to improve it in years to come.
All right, Mike Barnacle has a question.
Hey, Senator, can you enlighten me or explain to me how the insurance lobby, the insurance industry in this country suffer any pain at all under this bill that they hadn't suffered before?
Yeah.
Mike, no, I can't. The insurance companies are going to make out like bandits. Yeah. The drug companies are going to make out like bandits. No question about that. This is not a strong bill. It's not the bill I want. But on the other hand, tens of millions of Americans are finally going to get health insurance. There's going to be more primary health care access. There are a lot of good things, but I'm not going to argue with you. The insurance company is going to laugh all the way to the bank.
To use your words, they're laughing all the way to the bank. They're going to make out like bandits. How are the American people supposed to understand the truth here about this legislation?
Well, let me break the bad news to the American people. Big money interests control the United States Congress. That's the reality. Some of us, for years, I'm an independent, have been trying to give the working class, the middle class, low-income people some power. But the reality is campaign contributions. What do you think? We bailed out Wall Street. We're giving insurance companies, drug companies breaks. That's the reality here. But the choice that I have is whether you kill this bill and you allow 46 million Americans to continue with no health insurance. I think that's the worst option.
Well, I kind of like the way you're characterizing things. It sounds like the first most realistic assessment of the way Washington is working right now and has worked in the past than I've heard in a long time. But Jean Chatzky, go ahead.
Senator Sanders, is it possible for the insurance companies and big pharmaceuticals to win and for the people to win on a sustainable basis? I'm not talking about year 1 or 2 or 3,
right.
But look out 10 years for me and tell me, can we keep this going?
Yeah.
Very good point. And the answer is, this is what happens. And this is not insignificant. 45,000 people a year die in this country because they don't have access to doctors, they don't have health insurance. We can address that problem today. But your question is a very good question. Long term, is it sustainable for individuals who are paying premiums or for the government when we're continuing to see health care costs soaring? And the answer is no, it is not. That is why, in my view, in a reasonably short while, we're going to be back here, and I hope, with the support of the American people, Congress has the guts to take on the insurance companies and the drug companies and tell them we cannot continue to pay by far the highest prices in the world for prescription drugs or for health care.
Senator Sanders, according to your analysis, it sounds like you're going to come back to this in the future, and the drug companies and the health insurance companies will win again. And I don't see why, when you go back to deficit reduction in the future, that these health care benefits, these subsidies won't be the first thing that are cut.
That is a very good point. That is a very fair point.
We just can't win with you. You agree to it.
Well, no, you know,
we try to hit you hard. You agree with everything we say.
This guy is making sense.
Look, what I'm saying, what I'm trying to say, is the political situation in this country, it was worse under the Republicans. Nothing was done that didn't have the support of the big money interest. I think it is better under the Democrats. At least we are trying. They're trying to do something. But we've got a long way to go as a nation.
Yes, and I would just argue that perhaps you might want to tell your Democratic friends and those in the White House as well that trying to sell a narrative that the insurance companies are going to pay and this is going to increase competition, when you're telling me that they are laughing their way to the bank. I want to know what the truth is.
We have to thank Senator Sanders for his honesty. I first of all want to thank Senator Sanders for his honesty.
He's always honest.
Very important.
He's always honest.
And why can't we just say, you know what, this is sometimes the way Washington works. It's not pretty. I don't like it. It doesn't feel good. But
the
this is what
insurance lobby.
All right, let him talk.
Let me just say this. If you want the solution, which the rest of the world has, comprehensive universal health care for all and cost effectively, you need a Medicare for all single-payer system.
I agree.
We get 5 votes for that. 5 votes for that in the U.S. Senate.
And the insurance
You have
lobby,
a vote for it right here, Senator.
The insurance lobby in this country makes the gun lobby look like common cause.
All right. Senator Bernie Sanders, will you please come back? We'd love to have you on.
My pleasure.
All right, take care. Good luck in there.
Thank you.
Tell folks to tell the truth. All right.
Boy,
go to a break.
he really stumped.
Round of applause for Joe.
He was great. And, we got to hand it to Joe, who has been talking about this from day one and looking like a naysayer or one of these Republican Party of No people. That has not the case. It is the truth that they have compromised along the way, and it has been whittled down to something that does something, but it is not what they set out to do, and they are not taking the insurance companies to task. Someone give me a legitimate argument, a legitimate piece of information that shows they will suffer in any way.
I think the stock market gave you the answer.